In healthcare, every word matters. Language barriers are a constant, costly challenge. What if you could cut your interpretation budget by over 60%? One facility already did. The difference is stark. An average of $25 for a VRI call versus over $66 for in-person. But this isn't just about saving money. It's a fundamental shift in how we provide care. We'll break down the savings, operational gains, and the future of integrated language access. So, where do these dramatic savings actually come from? It starts by removing the hidden costs of on-site services. First, VRI cuts interpreter travel time and mileage costs. That's an average of 24 minutes and nearly $5 saved per session. Second, it gets rid of 2-hour minimum fees. You pay only for the time you actually use, perfect for quick check-ins. Third, the on-demand model means you connect only when needed, optimizing budget for unplanned medical situations. This model provides incredible flexibility. Your facility can scale services up or down instantly based on patient flow. The financial case is clear, but efficiency is also measured in seconds, not just dollars, especially in an emergency. In-person interpreters can take an hour or more to arrive. VRI connects you to a qualified medical interpreter in seconds. Consider an emergency department. A patient arrives with chest pains but doesn't speak English. A wait for an on-site interpreter is a serious delay in diagnosis. With VRI, a provider gets consent for a procedure, understands allergy information, and explains a diagnosis almost instantly, directly reducing medical error risk. Preventing just one adverse event or hospital readmission due to miscommunication can save tens of thousands of dollars. The speed of VRI pays dividends. But with this speed and remote connection, do we sacrifice the quality of the interpretation? Is something lost when the interpreter isn't in the room? Let's look at the evidence on how VRI performs in a clinical setting. The results may surprise you. The answer is no. In fact, video can strengthen communication. Both patient and provider see the interpreter's facial expressions, confirming understanding. Studies confirm VRI is an effective and safe method for communicating with patients who have limited English proficiency. It demonstrably increases patient satisfaction. Imagine a difficult diagnosis. Seeing a compassionate interpreter's face on screen builds trust. This visual connection is central for patient-centered care. Let's go deeper on preventing errors. Clear communication is the foundation of patient safety. When a patient understands their discharge instructions, readmission rates drop. This isn't just a clinical benefit, it is a financial one. Reducing readmissions directly impacts your bottom line, creating a second layer of cost savings. So VRI saves money and improves care today, but the real advantage lies in where the technology is going tomorrow. First, expect direct integration into EMR and EHR systems. Launch an interpretation session from the patient's chart with a single click. Second, AI will augment the human interpreter. Think live transcription for documentation and instant summaries of key medical points. Third, language support will be standard in telehealth platforms. This ensures equity in remote care and monitoring for all patients. Because of these cost and tech advantages, the market trajectory is clear. Video interpreting services are projected to lead the medical interpretation landscape. Now, let's connect the dots. Remember the operational efficiency we discussed? EMR integration supercharges it, cutting admin time and further reducing the cost per encounter. Recall the need for speed in emergencies. AI summaries ensure that information gathered in that rapid exchange is captured accurately, improving handoffs and care continuity. The market's shift to VRI isn't just about the 60% savings, it's because it simultaneously cuts costs while improving the safety and accuracy we demonstrated. The evidence points to one conclusion. The question is no longer if your institution should adopt VRI, but how to implement it for maximum benefit. In 2025, Video remote interpreting is a strategic advantage. It offers a powerful combination of financial savings, operational agility, and improved patient outcomes. Remember the numbers: over 60% potential budget reduction, a cost per encounter slashed from over $66 to just $25. This is about building a more efficient, equitable, and safer healthcare system, one where language is a bridge, not a barrier to quality care. It's time to assess your language access strategy. See how VRI can produce these benefits for your patients and your budget.